Welcome to the Vet and Crit Academy, where we discuss veterinary emergency and critical care and science-based tools for vet professionals. Hey everyone, here's what you'll learn by the end of this video. Does colonic torsion in dogs mean a poor prognosis, or is it better than we thought? This research focused on colonic torsion and volvulus in dogs, rare but critical emergency that can cause severe complications like ischemia, necrosis, and even death. By the way, you can download a completely free checklist on diagnosis of shock in dogs and cats by clicking on the link in the description. Historically, the prognosis for this condition has been not great, but recent advancements in surgical management have prompted a re-evaluation of outcomes. The study retrospectively analyzed medical records of 28 dogs diagnosed with colonic torsion and/or volvulus. All of these dogs underwent surgical treatment, and their researchers evaluated their clinical presentation, intra-op findings, and post-op outcomes. So what did they find? The median age of these dogs was 7 years, with the median body weight of 40.7 kilograms. The top three most common breeds were Labrador Retrievers in 32% of cases, Great Danes in 28.6%, and German Shepherds in 17.9% of cases. The most common presenting clinical signs included the following: vomiting in 78.5% of cases, diarrhea in 35.7% of the cases, tenesmus in 28.5% of cases, as well as restlessness and abdominal distension in about 10 to 14% of the cases. The most common radiographic findings included severe gas distension of the colon in all cases, malposition of the cecum and/or colon in 50% of cases, and abrupt termination of the descending colon in 20% of cases. On these images taken from the paper, you can see a left lateral radiograph of the abdomen of a 7-year-old castrated male Labrador Retriever with a radiographic diagnosis of colonic torsion on the initial study, followed by spontaneous resolution. On the image to the left, you can appreciate markedly distended colon with a pinching of the proximal colon. The subsequent study on the right showed resolution of the narrowing of the colon. One intriguing finding was that in about 35% of cases, in other words, 10 of 28 dogs, the torsion appeared to resolve spontaneously at the time of surgery. All of these dogs had varying signs of localized serosal bruising along the colon and colonic vessels that were strongly suspicious of prior torsion. This phenomenon, referred to as dynamic torsion, highlights the potential for spontaneous improvement in some of these dogs. Overall, survival rate was excellent, with 27 of 28 dogs surviving to discharge. The dog that was euthanized prior to discharge had a splenectomy and left-sided gastropexy performed during the initial surgery when colonic torsion was diagnosed. This dog initially recovered and uneventfully from surgery, but collapsed immediately prior to discharge. Subsequent abdominal ultrasound found a hemoperineum suspected to be secondary to a ruptured liver mass that was not identified earlier. In addition, a small mediastinal mass was noted on the pre-op chest radiographs of this dog, which probably influenced the owner's decision to perform humane euthanasia. Another dog that was discharged home was euthanized a few days later due to suspected mesenteric torsion. Both dogs were euthanized during the perioperative period, yielding a survival rate of 92% in the current study. So, what can we take away from this study? First, it's clear that colonic torsion is not a death sentence. With surgical interventions, survival rates are relatively good and long-term outcomes are generally excellent. Second, approximately 1/3 of the dogs diagnosed with colonic torsion and/or volvulus, based on radiographic findings, experienced spontaneous resolution during subsequent studies or at the time of surgery. Similar to previous reports, many dogs had a previous history of gastrointestinal disease and received gastropexy prior to presentation. Overall, this study provides a much-needed update on the management of colonic torsion in dogs. That said, the study wasn't without limitations. It was retrospective, meaning there were variations in surgical techniques and treatment protocols which could influence outcomes. Additionally, follow-up data was only available for a subset of dogs. If you enjoyed this video and want to see more content like this, leave a comment below and don't forget to explore the VetMCrit channel for more. Bye-bye.